Hi guys, welcome to this week's Ask Amy. I've been traveling a lot lately, and I'll tell you what, kind of re-emphasized the way that I feel about American Airlines. Fortunately, I only had to fly American once this spring. The rest of the time I had the opportunity to fly Southwest, which is my all-time favorite. I think we all kind of have that sentiment. But one of the things that's so frustrating to me about American Airlines is you go up to the counter. I finished a meeting, got to the airport quicker than I anticipated. American, I checked, they had availability on the flight before the one I was on. So I go up to the gate and said, hey, I'm here a little early. Looks like you have room. Can I get on this plane? And the gal gets on her computer and, asks for my ID, gets on her computer and spends like 30 seconds looking at, I don't know what. I kind of want to lean over and say, what you looking at? What are they trying to find? Are they trying to bring up my driving record? What are they trying to bring up? I don't understand. And so, she just sits there for a few minutes, stone faced, typing on her computer, and then she says, "Oh, you bought the inexpensive ticket, and it's going to cost you $213 more if you want to get on this flight." I'm like, forget it. It just makes no sense to me. Whereas Southwest, on the other hand, you go up to their gate, and I don't care if it's, if I bought the cheap ticket or not, go up to the gate and say, hey, I'm here a little early. Do you think I can hop on your plane? They're like, oh, yeah, let me see your boarding pass. Yeah, we've got room. Not a problem. Let me change that over for you. They're not spending all their time on their computer trying to, I don't know if they're checking with their manager. I don't know what they're doing, but it just makes no sense. And so I kind of did a little bit of digging and reading and research. And one of the things I discovered about Southwest Airlines is they have basically three parameters. And they give their employees the empowerment, the ownership, whatever you want to call it, to make the right decision for the company and for the customer. And so they have three parameters. If a customer wants something, it's number one, is it going to keep the plane on time? Okay, if it's going to make the plane run late for some, request from a patient, or I'm sorry, from a customer, then if it's going to make the plane late, that's probably not going to work. Is it going to cost the company any more money? And if it's not, gosh, go for it. Just do it. And is it going to make the customer happy? By far. I mean, absolutely. So for me to hop on a plane prior to the one I was already booked on, it cost them no more money. It made me happy, and it kept the plane on time. That's a no-brainer. I mean, that just makes sense. And so, as a consumer, I want to spend my resources and my time with people and in places that make me feel good. That makes me feel good. It's not, a big bureaucracy where we've got to get on our computer for, 10 minutes to figure out if you're worthy of catching an earlier flight. No, they just make the right decision. And I'll tell you, that's leadership. That is vision. That is understanding their why and what's most important. It allows the customers to have an experience based on what happens behind the scenes in terms of leadership and vision. If you are having a hard time making decisions, if you're having a hard time answering patients' requests because you don't know what the doctor would want, or you don't know if it's the right thing to do, then you guys are probably lacking in your vision, in your purpose, in your why. Okay? Do you have parameters like Southwest? Whereas if it gets the plane on time, it doesn't cost us any more money, and the consumer's happy, just do it? Do you have parameters that simple? Or is everything have to be run, through everybody and overthought and over-discussed? What does that look like in your practice? My hope is after this last round of meetings where we really dissected and looked at discovering your why, that you've been able to have some more conversation as a team, that you've been able to come up with some very simple parameters when it comes to decision making. See, team, you shouldn't have to run to your doctor or your office manager every time something comes up. Okay? You should be able to make those decisions. And if you can't, it's up to you to go and clarify that with the doctor and say, hey, can we sit down and talk vision a little bit so that I don't have to interrupt patient interactions all the time to come and figure out what's best to do. That's what I would encourage you to do. See, people have no idea how to judge your dentistry. Okay, they only know how to judge a good experience. Just like at Southwest Airlines, I have no No idea whose planes and pilots are better. I don't know whose pilots get more training. I don't know whose planes, have more, power or have gone through a more extensive process in terms of safety. I have no idea. All I know is I am treated better at Southwest Airlines than I am American, so that's where I choose to spend my time and resources. What about your patients? What are they using to measure? Okay, it's certainly not the margins of your crowns. It's certainly not the lab that you use. It's certainly not that last, CE that you spent tens of thousands of dollars on. What are your patients measuring in terms of their experience? What does that look like for you? Okay. My hope is that you guys will be able to have some conversation and talk about these things as a team and identify, maybe as simple as Southwest Airlines, what are 3 parameters we can set up in our practice that make it really simple to make decisions? Okay, it's all vision, guys. It all goes back to that. Thanks for listening. We'll see you next time.